Welcome to the We Level Up Treatment Center video series. In today's video we will discuss what is CPTSD. As we delve deeper into this topic, we'll not only review the basics but also consider the broader implications, treatment options, and the critical role of awareness and support. My aim is to provide a comprehensive understanding of CPTSD, making this speech a valuable resource for all of you. CPTSD, as we've discussed, arises from prolonged exposure to traumatic events. Unlike PTSD, which is often triggered by a single traumatic incident, CPTSD stems from long-lasting trauma that can persist or repeat over months or even years. This is what we refer to as complex trauma. To truly grasp the nuances of CPTSD, it's essential to understand its origins. Now, let's consider some of the common sources of complex trauma. While CPTSD can result from various traumatic experiences, it is frequently associated with childhood trauma. Childhood is a time of emotional development, and the effects of complex trauma during this critical period can be much more severe and enduring. Imagine a child living in an environment where they are exposed to persistent maltreatment, abuse, neglect, and unpredictable circumstances, with little to no control over their situation and a profound sense of hopelessness. These children may develop what we call hidden traumas. These traumas disrupt their neurological, emotional, and psychological development, setting the stage for CPTSD in adulthood. Let's take a moment to consider the impact of this hidden trauma in adults. Many adults may be dealing with anxiety, sadness, and relational issues, often without fully understanding the role played by their childhood wounds. Trauma is intricate and can sometimes be traced back to specific events such as battle trauma, abuse, or accidents. But when it's not limited to a single incident and is frequently overlooked, the outcomes can have lasting impacts, often manifesting as symptoms of complex post-traumatic stress disorder. The symptoms of CPTSD can be overwhelming, encompassing emotional, physical, and behavioral aspects, as we've discussed. It's crucial to recognize that CPTSD can be confused with other mental health conditions, such as major depressive disorder, generalized anxiety disorder, or even personality disorders. This complexity underscores the importance of seeking a proper diagnosis from a qualified mental health professional. One of the key distinctions between CPTSD and other mental health conditions is the frequency and duration of the trauma. While PTSD tends to result from a one-time traumatic event, CPTSD is rooted in long-lasting trauma that persists or recurs. This is particularly relevant when we consider the effects of oppression, racism, and confinement, which often lead to CPTSD. Moreover, CPTSD can also be linked to the experiences of survivors of human trafficking or individuals subjected to ongoing childhood sexual abuse by a relative. The exposure to frightening, uncertain, and unpredictable situations in an abusive environment can lead to the development of CPTSD. The body's stress response becomes intertwined with these experiences, making it difficult for individuals to escape the cycle of trauma. As we explore the depths of CPTSD, it's important to acknowledge that it can also intersect with other conditions, such as autism. Although the symptoms may appear similar, the underlying causes of these behaviors are distinct. Autism typically emerges in response to neurological development, whereas CPTSD arises in response to traumatic events. It's a reminder that understanding the root causes of these conditions is crucial for providing appropriate support and treatment. Living with CPTSD can be extremely challenging, as individuals may experience not only the core symptoms we've discussed but also vivid emotional memories that make it difficult to regulate their emotions. This can lead to severe depression, suicidal thoughts, and difficulties in managing anger. It's a complex web of emotions that can feel overwhelming. However, there is hope for those living with CPTSD. Healing from complex trauma is possible, and it's a journey that often begins with finding a therapist specializing in trauma therapy with specific training in treating CPTSD. This professional guidance is invaluable in helping individuals navigate the complex emotional landscape of CPTSD. In addition to therapy, engaging in supportive activities like yoga, mindfulness practices, and spending time in nature can provide a sense of calm and healing. These practices offer individuals tools to cope with the intense emotions and triggers associated with CPTSD. Another critical element in the healing process is practicing self-compassion. Rebuilding trust in oneself and others is a pivotal step, and self-compassion plays a vital role in this process. By extending kindness and understanding to oneself, individuals with CPTSD can begin to rebuild their emotional well-being. Furthermore, reaching out to friends and family is a crucial part of the healing process. Establishing a support network is essential, as the journey of healing from CPTSD can be long and challenging. Friends and family can offer a listening ear, emotional support, and a sense of belonging that can be deeply healing. In addition to these key elements of healing from CPTSD, it's worth noting that treatment often includes medication and lifestyle interventions. Medications can help manage some of the symptoms, while lifestyle interventions like yoga, meditation, and relaxation exercises offer individuals practical tools for managing their emotions and reducing the impact of CPTSD on their daily lives. Now, I want to emphasize the vital role of awareness and support in the context of CPTSD. Raising awareness about this condition is essential for several reasons. First, it can help reduce the stigma associated with mental health disorders, making it easier for individuals to seek help and support. Second, it encourages greater understanding and empathy, enabling friends and family to provide more effective support to their loved ones with CPTSD. Furthermore, awareness can lead to improved access to mental health services and resources for those affected by CPTSD. It's crucial to advocate for greater availability of specialized therapists and treatment options for individuals dealing with this complex condition. In conclusion, complex post-traumatic stress disorder is a challenging and often misunderstood condition with a profound impact on individuals' lives. The key to healing lies in understanding its origins, acknowledging the symptoms, and seeking the right treatment and support. By recognizing the distinctive features of CPTSD, understanding the intersection with other conditions, and appreciating the complexity of the healing journey, we can empower those affected by this condition to find their path to recovery and reclaim their lives. We Level Up Florida Treatment Center provides world-class care with round-the-clock medical professionals to help you cope. In addition, we work as an integrated team providing information about the complex trauma and other aspects of treatment. Make this your opportunity to reclaim your life. Call today to speak with one of our treatment specialists. Our specialists know what you are going through and will answer any of your questions. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.